Welcome to The Explainer. Today, we're diving into a crisis that, honestly, almost nobody is talking about openly. And no, it's not just about inflation, and it isn't just about Wall Street trends. Right now, there's this invisible collision happening right in the background of American life. We are literally witnessing two massive, deeply interconnected problems hitting us at the exact same time: a rapidly weakening social security system and a growing, silent epidemic of elderly loneliness. Put them together, and they're creating a financial and emotional disaster that could entirely reshape our future.
Put yourself in this position for a second. Imagine you're 78 years old. You live alone. You are completely dependent on a fixed monthly check just to cover your ever-rising healthcare costs and your groceries. And all the while, you constantly hear politicians debating about whether your benefits might be reduced. This isn't just cold economic math or some abstract policy debate. We're talking about baseline human dignity here. This is literally about survival for millions of older Americans who are suffering silently behind closed doors.
Okay, let's dive into part one: America's hidden financial disaster.
2033. That number is literally a ticking clock. According to the 2025 Social Security Trustees Report, America's Social Security Trust Fund is projected to face insolvency by 2033 or 2034. Now, let's be really clear here. Insolvency doesn't mean the program just vanishes into thin air, but it absolutely does mean that if lawmakers fail to act, it could trigger some devastating automatic benefit reductions. Millions of people who have faithfully paid into this system their entire lives could suddenly see their main lifeline slashed.
And that 2033 deadline? Well, it collides head-on with a staggering demographic reality. By 2030, every single baby boomer will be over 65 years old. Britannica points out that America is approaching a massive demographic transformation where older adults are eventually going to outnumber children. Think about what that means. We're looking at an unprecedented surge of retirees relying on a system at the exact moment it's facing its greatest financial strain. It is placing immense, crushing pressure on both Social Security and Medicare.
So, let's look at the numbers in part two, the impossible demographic math.
Look, the math just doesn't work anymore. Back in the 1930s, when the social safety net was built, it was for a totally different version of America. We had shorter life expectancies, and there were many more workers paying into the system for every single retiree drawing from it. Plus, families frequently lived together in multi-generational homes. Today, it's a completely different story. We live much longer. Birth rates are lower, meaning fewer workers are supporting more retirees, and our families are far more geographically fragmented. The Committee for a Responsible Federal Budget warns that this mathematical reality is creating trillions in future deficits. It's a structural issue, plain and simple, not a political talking point.
Which brings us to part three, the true cost of loneliness. Now, the sheer scale of this problem is pretty staggering. Nearly 28% of seniors currently live alone in America. Meals on Wheels America recently sent out a major warning that social isolation and food insecurity among seniors are fast becoming national emergencies. For so many people, a quick digital interaction has entirely replaced a real human one. We're talking about folks spending entire days, sometimes longer, without a single meaningful conversation.
And we really need to be crystal clear about what this actually means. Chronic loneliness is not just feeling sad. It is a measurable, dangerous physical condition. Medical researchers are increasingly comparing the long-term health risks of severe social isolation to things like smoking and obesity. It's that serious. Studies from AARP and NORC show that when older adults feel isolated, their anxiety about financial insecurity absolutely skyrockets. And when that financial vulnerability increases, the physical and mental health deterioration just accelerates even faster. This sets off a really devastating four-step vicious cycle. First, isolation sets in. Second, almost like a domino effect, that leads directly to worsened health, really accelerating cognitive decline and depression. Third, because of those poor health outcomes and a lack of daily support, emergency care costs just explode. We see hospitalization rates rise and dementia risk shoots up. And finally, step four, this all results in a massively increased dependence on government systems like Medicare and Medicaid. So what starts as a quiet, private, emotional tragedy ultimately transforms into a massive national economic burden.
Moving to part four, generational tension and fallout.
AARP research shows that younger adults have sharply dropped their confidence in the longevity of the Social Security system. And honestly, it's pretty easy to see why. Younger workers are already feeling economically boxed in by a crazy combination of student debt, massive housing inflation, rising healthcare costs, and stagnant wages. They're dealing with their own profound economic instability, right? Yet they are simultaneously being told they have to financially support a rapidly aging population through payroll taxes. It is a perfect storm for generational resentment.
So here is the crucial takeaway. When a society becomes entirely obsessed with productivity and speed, it starts viewing its elderly citizens simply as economic burdens. And history shows us that when that happens, moral decline inevitably follows economic decline. America simply cannot afford to normalize elderly abandonment. It destabilizes the entire culture. Let's shift gears and talk about solutions in Part 5, rebuilding the safety net.
The good news? This disaster can totally still be averted. We do not have to accept this as our inevitable future. Based on the data, here are 5 clear solutions to pull us back from the brink. First, we absolutely must protect and reform Social Security through serious, bipartisan adjustments that prioritize human dignity over quick political victories. Second, we have to rebuild community infrastructure. Think senior centers and affordable transportation, because human connection is literally preventative healthcare. Third, we should encourage multi-generational living to help lower housing costs and naturally reduce isolation. Fourth, we need to use technology correctly. It should be a tool to expand telehealth and bridge the gap, not a cheap replacement for human contact. And fifth, we fundamentally have to change how we view aging. We need to recognize the wisdom and mentorship that older Americans provide, rather than just treating them as economically irrelevant.
Ultimately, this whole thing requires a massive cultural shift. For decades, the ultimate American ideal was strict, rugged independence, but the future demands a shift toward healthy interdependence. Moving away from total isolation and toward connected, intergenerational communities is exactly how we lower costs, improve childcare support, strengthen family bonds, and ultimately save the safety net.
As we wrap up this explainer, I want to leave you with a pretty heavy, provocative question. Does America still believe human dignity matters after productivity declines? You know, the way a nation treats its elderly when they are no longer economically powerful is the true measure of its soul. Because remember, one day every single generation becomes the older generation, and the system we built today is the exact same system we are all going to depend on tomorrow. Thanks so much for exploring this with me today, and I'll catch you in the next one.